इन्फार्क्शन और शॉक आज की वीडियो का टॉपिक है एंड टुडे वी विल फिनिश चैप्टर नंबर 4 फ्रॉम रॉबिन्स पैथोलॉजी। जनरल पैथोलॉजी का ये चैप्टर आज हम कंप्लीट करेंगे। लेट्स बिगिन। व्हाट इज इन्फार्क्शन? एन इन्फार्क्ट इज एन एरिया ऑफ इस्केमिक नेक्रोसिस caused by occlusion of vascular supply to the affected tissue. It's a simple concept to understand. Suppose this is an organ, any organ of your body, and this is the blood vessel which is supplying blood, which means oxygen, nutrients to that particular organ. And for any reason, if this blood vessel is blocked, so there will be no vascular supply to that particular organ, particularly if this blood vessel is an end artery or कोई collateral circulation नहीं है. So what will happen? इस organ को there will be no supply of nutrients and oxygen, and it will be dead. So such necrosis where the vascular supply is affected is known as infarction. So the tissue will process, it will experience the process of infarction. So infarction is basically cellular death because of disturbed vascular supply. Infarction primarily affecting the heart and brain is a common process and extremely important because of its clinical illness. Now think about this. Heart is an extremely important organ, brain is an extremely important organ, and if there is any disturbance to the blood supply of these very vital organs, then those infarction becomes very important. So you all have heard of the terminology MI, myocardial infarction. So myocardial infarction में जो word infarction है, that simply denotes कि if this is the heart and there are different coronary vessels supplying different parts of the heart, if any one of them is blocked, so that part of the heart will be dead, and this is what we call myocardial infarction. So you can at least imagine कि how serious can it be, इसके consequences कितने serious होंगे अगर heart का कोई part जो है वो damage हो जाता है. Roughly about 40% of all death in the United States are consequence of cardiovascular diseases such as MI, with most of these death stemming from the myocardial on the cerebral infarction. Very important. Brain में infarct या heart में infarct. Pulmonary infarction is also common and it's a clinical complication. Bowel infarction, part of a small intestine or large intestine, that can also be fatal. Ischemic necrosis of the distal extremities such as gangrene. So for example in diabetics, so your foot area है for example, or blood vessels of the diabetics, if they are damaged और उनमें structural changes होते हैं because of complications of diabetes, so उसकी वजह से blood supply to the extremities can be disturbed, and if it is severely disturbed, it can also lead to gangrene formation, which means the death of the distal extremities. और उसमें फिर there are different types of gangrene, dry gangrene, wet gangrene, depending upon उसमें infection है नहीं है. But the point is कि the word infarction means death of the tissue because of the disturbed vascular supply. ठीक है? अब जिस भी organ में हो, it can be in heart, तो myocardial infarction, it can be in the brain, so it will be cerebral infarction, it can be in the gut, it can be in the proximal extremity, any part of your body which is receiving blood supply can experience infarction if the blood supply is stopped. ठीक है? Arterial thrombosis और arterial embolism underlies the vast majority of infarction. आपको पता है ना, अब ये दोनों terminologies, thrombosis से भी आप familiar हैं, embolism से भी आप familiar हैं, पिछली वीडियोस में मैंने बताया हुआ ही है. So if this is for example an artery और इसमें कोई thrombus बन जाता है, platelet aggregation for so many different reasons, जिसके underlying mechanism most of the time होता है endothelial injury, and then there is a plug formation. So thrombus बन जाएगा तो blood supply reduce हो जाएगी. Sometimes the thrombus detaches and it travels in the vascular system and it can block the smaller arteries या arterioles, उनको जाके block कर देगा. So thrombus हो या embolus हो, these are common causes of infarction. And it makes sense कि यहाँ पे अगर एक tissue है और यहाँ thrombus बन गया है, तो the tissue is now susceptible to infarction because of the thrombus. Lumen vascular supply का छोटा हो गया, जिसकी वजह से blood अब कम गुजरेगा और oxygen supply कम होगी, infarction हो सकता है. इसी तरह embolus है, अगर जाके वो किसी भी arterial system को block करता है, तो उस arterial tree के आगे जो भी organ है उसको blood supply नहीं मिलेगी, and because of embolus now there will be infarction. There are some less common causes. Less common causes of arterial obstruction include vasospasm. Because of any reason, there is a sudden contraction of the arterial system, but this is less common. Expansion of an adenoma secondary to intraplaque hemorrhage. एथेरोस्क्लेरोसिस का फिनोमिना ऐसे होता है कि द एंडोथेलियम के अंदर देयर इज फैट डेपोजिशन एंड दीज आर कॉल्ड द एथेरोमेटस प्लेक. समटाइम्स दे रप्चर, ब्लीडिंग होती है इसमें, बट दैट is a less common cause of thrombus formation, या that's a less common cause of occlusion of the blood vessel. The more common causes are thrombosis and embolism. Okay, then what other causes you should know? Extrinsic compression of a vessel, such as because of a tumor. Suppose there is a blood vessel here and there is any organ और उसमें कोई tumor develop होता है तो it will compress the blood vessel. तो इसकी वजह से भी अगर compression होगा तो blood आगे सही से pass on नहीं हो सकेगा and infarction can happen. But again, this is not as common as thrombus or embolism. ठीक है? Dissecting aortic aneurysm, edema within a confined space such as in the compartment syndrome. So for example, किसी का leg है और ये leg में there is an inflammation or because of that inflammation there is a compartment syndrome. So the pressure inside any one particular compartment such as lateral compartment or anterior compartment of the leg, the pressure increases because of inflammation, and because it's a closed compartment, this increased pressure can compress the blood vessel, और blood vessel जब compress होगी तो again extremities में blood नहीं पहुंचेगा. There are some more causes of infarction which are again uncommon या less common causes, and they include twisting of blood vessels such as testicular torsion. में कोई blood vessel twist कर जाए तो वो block हो सकती है. Traumatic vascular rupture, entrapment in a hernial sac. So these are all the causes which are some way or the other, they are either blocking the blood supply or they are diminishing the blood supply to the particular organ and making the organ susceptible to infarction. Okay, although venous thrombosis can cause infarction, the common outcome is simply congestion. Typically, bypass channels rapidly open to provide sufficient outflow to restore the arterial inflow. That's an important line. देखें, अभी तक हम जितनी बात कर रहे थे वो बात कर रहे थे आर्टीरियल सप्लाई की, कि ये एक आर्टरी जा रही है इस ऑर्गन तक, बट आपको पता है कि दिस इज़ एन आर्टरी, फिर उससे आर्ट्रियोल और कैपिलरी, और सपोज ये ऑर्गन है तो ये इसको सप्लाई करने के बाद जो फिर इससे एग्जिट फिनोमिना है वो वेन का है. सो देयर इज़ अ वेन विच एग्जिट फ्रॉम द ऑर्गन एंड इट कैरीज द डीऑक्सीजनेटेड ब्लड. सो आर्टरीज आर ब्रिंगिंग इन द ब्लड एंड वेन्स आर कैरिंग द ब्लड अवे. अब तक हमने जितनी भी बात की कि थ्रोम्बस है या एम्बोलस है या ट्यूमर से ऑक्लूजन है, व्हाटसोएवर, वी वर टॉकिंग अबाउट द आर्टीरियल एंड ऑफ द ब्लड सप्लाई, कि अगर यहाँ पे कोई भी ब्लॉकेज है तो उसकी वजह से ऑर्गन को ब्लड सप्लाई नहीं मिलेगा. बट दिस ऑल्सो हैपन्स कि देयर कैन बी अ वेनस थ्रोम्बस एज वेल, तो यहाँ पे भी ब्लॉकेज हो सकता है. यहाँ अगर ब्लॉकेज होगा तो डायरेक्टली इस ऑर्गन की ब्लड सप्लाई बंद नहीं हो रही, बिकॉज आर्टरीज आर फाइन, पीछे से ब्लड सप्लाई ठीक आ रही है. आगे चूंकि ब्लड जा नहीं रहा तो यहाँ ब्लड जमा होना शुरू हो जाएगा, एंड दैट इज अ condition which we call congestion. So congestion is a phenomena जो हमने अर्लियर इस चैप्टर की जो वीडियोस मैंने बनाई हैं उसमें ही हमने मेंशन किया हुआ है कि जो congestion का फिनोमिना है वो बेसिकली ये होता है कि there is a venous occlusion, और venous occlusion की वजह से there is back pooling of blood, and when there is back pooling of blood, this back pooling of blood is known as congestion. But लिटरली होता इस तरह है कि इफ देयर इज कंजेशन ड्यू टू वेनस ऑक्लूजन, देयर आर सम कोलेटरल वेनस चैनल्स स्टार्टेड, यू नो, एंड द ब्लड स्टार्ट्स एग्जिटिंग फ्रॉम दोज कोलेटरल वेनस एग्जिट्स. और एक दफ़ा जब वो वेनस एग्जिट से ब्लड निकलना शुरू हो जाता है तो कंजेशन ख़त्म हो जाती है, और पीछे आर्टीरियल सप्लाई में तो कोई मसला था ही नहीं, तो फिर प्रॉपर ब्लड सप्लाई आती रहती है, और दैट इज़ यूजुअली रीस्टोर्ड दिस वे. सो यू शुड नो व्हाट इज़ द डिफरेंस बिटवीन आर्टीरियल ऑक्लूजन which usually leads to infarction and venous occlusion which leads to congestion, and if the exit pipelines are established then the congestion is gone away and then the arterial supply was never disturbed. ये तो ठीक ही थी, ये तो कभी ख़राब हुई नहीं थी. सो ये सारा आपको पता होना चाहिए कि venous occlusion से भी congestion होता है, बट यूजुअली infarction का जो फिनोमिना है वो आर्टरीज के साथ अफेक्टेड होता है. लेकिन अगर मैं आपसे बार बार यहाँ कह रहा हूँ कि अगर वेन ऑक्लूड होती है तो पैरेलल चैनल्स ओपन हो जाते हैं ब्लड को एग्जिट करने के लिए, बट कुछ ऑर्गन्स आपकी बॉडी में ऐसे भी हैं जिनमें सिर्फ एक ही वेन है और कोई पैरेलल ऑर्गन एग्जिट फिनोमिना नहीं है. तो अगर एक ही वेन होगी और वही ब्लॉक हो गई तो कंजेशन होगा, कंजेशन के बाद इन्फार्क्शन हो जाएगा, वो टिश्यू ने ठीक फिर नहीं होना. सो इन्फार्क्ट्स कॉज्ड बाय वेनस थ्रोम्बोसिस डज यूजुअली अकर ओनली इन द ऑर्गन विद अ सिंगल इफरेंट वेन सच एज टेस्टिस एंड ओवरीज. उनके पास, आप समझ रहे हैं ना इस बात को, देखें ये एक ऑर्गन है, इस ऑर्गन के पास ये वेन है और यही एक वेन है और यही वेन ब्लॉक हो गई तो ब्लड यहाँ से अब निकल नहीं रहा, पीछे कंजेशन हो गई है, इन्फार्क्शन हो जाएगा। लेकिन अगर कोई ऐसा ऑर्गन है जिसमें एक वेन ये थी ब्लॉक हुई, नो प्रॉब्लम, दूसरी वेन है जो ब्लड को एग्जिट करवा देगी, एक और वेनस चैनल है जिसमें से ब्लड निकल जाएगा। तो जब ब्लड निकल जाएगा कंजेशन भी खत्म हो जाएगी। लेकिन अगर एक ही इफरेंट वेन है, ले जाने वाली वेन एक ही है, तो फिर तो भाई मामला हो गया गड़बड़। अब ये ऑर्गन में कंजेशन खत्म नहीं होगा और इट विल लीड टू इन्फार्क्शन। सही है, तो ये इन्फार्क्शन के बेसिक कॉन्सेप्ट्स हैं। नाउ इन्फार्क्ट्स आर क्लासिफाइड बेस्ड ऑन देयर कलर and which is basically depending on the amount of hemorrhage। जितना ज़्यादा ब्लड उसमें आएगा उस हिसाब से उसका कलर होगा, है ना। Infarcts can be red infarct which are also called hemorrhagic infarct because there is a lot of blood in there, or it can be white और एनीमिक इन्फार्क्ट, क्योंकि इसमें ब्लड कम होगा तो इट अपीयर्स वाइट, सो रेड और वाइट। एंड दे मे ऑल्सो बी क्लासिफाइड बेस्ड ऑन इन्फेक्शन, अगर प्रेजेंट है तो नोन एज द सेप्टिक इन्फार्क्ट, एंड इफ देयर इज नो इन्फेक्शन देन इट इज कॉल्ड अ ब्लैंड इन्फार्क्ट। अब रेड इन्फार्क्ट क्या चीज़ है, एज द नेम इंडिकेट्स इट अकर्स एज अ रिजल्ट ऑफ वेनस ऑक्लूजन। वेनस ऑक्लूजन हो गई, पीछे कंजेशन हो गया, यानी बहुत सारा ब्लड है। अब चूंकि बहुत सारा ब्लड है तो दिस टिश्यू विल अपीयर मोर रेडिश, है ना। रेड इन्फार्क्ट्स आर ऑल्सो कॉमन इन लूज टिश्यूज, सॉलिड ऑर्गन्स में वाइट इन्फार्क्ट्स आर कॉमन, and the red infarcts in the tissues with dual circulation such as lung and small intestine where partial albeit inadequate perfusion of the collateral arterial supply is typical. Now what does that mean is a long typical story, but you should know that red infarcts number 1 venous occlusion में common है, number 2 loose tissues में common है, and organs which have dual blood supplies such as small intestine, lung, यहाँ पर भी red infarcts common है because एक channel बंद होता है तो दूसरा channel still bleed कर रहा होता है। It causes more and more blood coming in previously congested tissue, और congested tissue is obviously a red infarct। कंजेशन का मतलब ही है कि उसमें बहुत सारा ब्लड है क्योंकि वेन जो चैनल है वो ब्लॉक हो गया है। When flow is re-established after infarction has occurred, such as after angioplasty, तब भी red infarct common होता है। So for example, if this is heart और यहाँ एक blood vessel थी जिसमें किसी भी वजह से ऑक्लूजन हुआ और अब कोई बाईपास सिस्टम कर दिया और ये अब जो ये वाला पार्ट था हार्ट का, इसकी ब्लड सप्लाई रीस्टोर हो गई किसी भी सर्जरी से, ऑपरेशन से। आई एम नॉट गोइंग इनटू द डिटेल्स सच एज एंजियोप्लास्टी में जो हम करते हैं। सो अब ये जो पार्ट है इसकी ब्लड सप्लाई चूंकि फौरन से रिज्यूम होगी, सो देयर विल बी अ लिटिल मोर ब्लड इन देयर एंड दिस विल अपीयर रेडिश एंड infarct can still happen in this area because sometimes the collaterals are also blocked and they are not enough. So if such bypass infarct happens, this is also called red infarct. So red infarct का concept ये है कि जहाँ कहीं blood ज़्यादा होगा वहाँ infarction red होगा, and that's why it is called red because it contains a lot of blood, hemorrhagic infarct. अब ये usually होता है venous occlusion में, but there are so many other scenarios जो आपको पता होने चाहिए, which we just discussed. Then what is a white infarct? It occurs with arterial occlusion. अगर किसी organ की artery बंद कर दी जाए, so if the artery is blocked, then the blood supply is blocked. और ब्लड सप्लाई ब्लॉक होगी तो अब ब्लड कम होगा, ब्लड ज़्यादा नहीं होगा। ब्लड कम होगा तो इट्स अ वाइट इन्फार्क्ट एंड इट यूजुअली हैपेंस एंड सीन इन सॉलिड ऑर्गन्स विच हैव पर्टिकुलरली एंड आर्टेरियल सर्कुलेशन। यानी एक आर्टरी है वो इस पार्ट को सप्लाई कर रही है, कोई भी ऑर्गन है, और यही एक आर्टरी है जो इस पार्ट को सप्लाई कर रही है। अब अगर ये आर्टरी ब्लॉक हो जाएगी तो यहाँ पे इन्फार्क्ट हो जाएगा क्योंकि ब्लड नहीं आ रहा। दिस इज द वाइट इन्फार्क्ट, दिस विल ऑल बी द वाइट इन्फार्क्ट, ठीक है। सो it's also called the pale infarct as I just told you in a minute ago, and it's commonly seen in the solid organs and where the tissue density limits the seepage of blood. So infarcts tends to be wedge shaped. इनकी usually shape इस तरह होती है कि जो so if for example you see here they are usually wedge shaped, ठीक है। तो यहाँ से अगर ब्लड सप्लाई ब्लॉक हो रही है तो ये पूरा एरिया इस तरह से वेज शेप होगा। बहरहाल ये डिटेल इतनी इंपॉर्टेंट आपके लिए नहीं है। Infarcts resulting from arterial occlusion in organs without a dual circulation typically become progressively paler. ये बात भी समझ में आती है, आहिस्ता आहिस्ता वो पेल से पेल होता चला जाता है। एंड extravasated red cells in the hemorrhagic infarcts are phagocytosed by macrophages. Yes, this is again not something that is very relevant here. It's understandable कि अगर hemorrhagic infarct है तो there are more RBCs there. If there are more RBCs there, then macrophages will come and try to eat those RBCs. That's a normal phenomena. In most tissues, the main histologic finding associated with infarct is ischemic coagulative necrosis. ये हमने chapter 2 में discuss किए हैं different types of necrosis. So go watch there what is ischemic coagulative necrosis. An inflammatory response begins to develop at the margins of the infarct. Usually when there is an infarct, so for example if this is an infarct, तो इसके जो margins होंगे यहाँ पे immune cells will start reacting because this is the normal tissue and this is the infarcted tissue. So normal tissue में जो normal immune cells हैं, they will start recognizing and reacting against the infarcted tissue. So that whole cycle of immune reaction will ultimately lead to necrosis. ठीक है? पर्टिकुलरली ब्रेन में होती है लिक्विफेक्टिव नेक्रोसिस. ये नेक्रोसिस के चैप्टर्स के टॉपिक हैं तो मैं यहाँ इनको टच नहीं कर रहा. व्हाट इज सेप्टिक infarcts? It basically occur when the infarcted area becomes septic. उसमें कोई infection हो जाए, such as for example infected cardiac valves, vegetations they embolize, or when the microbes are seen in the necrotic tissue. So heart में for example ये heart का valve है और यहाँ पे कोई growth हो गई है और यहाँ से वो detach होके circulation में enter हो जाती है. So now septic focus which was present only in the heart valves is now circulating in the body. अगर ये किसी भी arterial system को जाके block करेगा, so remember this has infective foci and now the infarct can also be infected. So such sort of thing. या अगर किसी body के part में infarct है और वहाँ कोई भी infection हो जाता है, so that will then turn into a septic infarct, which is obviously much more difficult to handle in comparison to a bland infarct. Obviously यहाँ पे अब आपको you have to think about antibiotic usage so that generalized inflammation and infection does not happen. So that was the story about infarct. Now factors that influence infarct development. Now see, there are so many different things जो decide करेंगे कि infarct किस तरह का होगा, infarct होगा या नहीं होगा. So for example, if मेरे पास एक tissue है, this is a tissue, इस tissue को ये blood भी vessel supply कर रही है और इसी tissue को equally ये blood vessel भी supply कर रही है. अब suppose इस blood vessel में occlusion हो जाती है तो इस tissue को कोई नहीं फर्क पड़ने लगा क्योंकि इसके पास alternate blood supply मौजूद है. लेकिन अब scenario change कर दूँ अगर कि there is a tissue और इसकी सिर्फ यही एक blood supply है, कोई और blood supply नहीं है, तो medical terms में हम कह रहे हैं कि there is no collateral circulation. So collateral circulation does not exist in this case. If this blood vessel is now blocked, this tissue will be infarcted. So this is an example of just by virtue of the fact कि collateral circulation present है या नहीं है, the outcome will differ. If collateral circulation is present in a tissue, infarcts are uncommon. If there is no collateral circulation, rather there are end arteries, such as the only one artery there, यानी collateral circulation नहीं है, इस केस में infarcts होंगे उस tissue में. The tissue is more susceptible to infarcts. ठीक है, तो इस तरह factors काफ़ी सारे होते हैं जिन पर infarct का होना या ना होना depend करता है. So the effect of vascular occlusion range from consequential यानी कुछ नहीं होगा to tissue necrosis यानी necrosis होगी. कुछ नहीं भी हो सकता, जैसे इस केस में arterial system पूरा block हो गया लेकिन कुछ नहीं हो रहा. इस केस में arterial system block हुआ लेकिन infarct हो रहा है. So that depends upon so many different things such as anatomy of the vascular supply. The presence or absence of an alternative blood supply is the key factor. जो मैंने आपको यहाँ पे अभी बात सारी समझाई, that is all written here. Rate of occlusion. Slowly developing occlusions are less likely to cause infarction because they allow time for development of the collateral blood supplies. This is very important point कि अगर slow and steady growth of the thrombus है, then there is time for the tissue to release factors such as VEGF to form new blood vessels. तो अगर ऐसा टिश्यू जिसके पास एक ही ब्लड वेसल है लेकिन उसमें स्लो थ्रोम्बस यानी फॉरन ऑक्लूजन नहीं हुई, ऐसा नहीं हुआ कि बम्प फॉरन ब्लड सप्लाई रुकेगी तो इन्फार्क्शन हो जाएगा. स्लोली ब्लड सप्लाई रुकेगी तो दूसरी ब्लड वेसल्स के बनने के चांसेस हैं, उसका टाइम है. सो रेट ऑफ ऑक्लूजन इज ऑल्सो एन इंपॉर्टेंट फैक्टर. देन टिश्यू वल्नरेबिलिटी टू हाइपोक्सिया, दिस इज अ वेरी की फैक्टर. सो फॉर एग्जांपल न्यूरॉन्स अंडरगो irreversible damage when deprived of their blood supply for only 3 to 4 minutes. जरा न्यूरॉन्स का ब्लड सप्लाई 3 से 4 मिनट रोक के देखें and they at the cellular level have signs of irreversible damage. They're gone, will never be repaired again. Myocardial cells, for example, they are a little tough than the neurons and they still die after 20 to 30 minutes. So myocardial cells, 20 to 30 minutes, you infarct them and they are dead. Irreversible changes. By contrast, the fibroblasts within the myocardium remain viable after many hours. So the point is कि इन्फॉर्क्शन से क्या डैमेज होगा ये बहुत सारी चीज़ों पर डिपेंड करता है. सच एज वन ऑफ द फैक्टर इज़ द वल्नरेबिलिटी ऑफ द टिश्यू. सो बास टिश्यूज़ जो हैं वो बहुत ही सेंसिटिव हैं फॉर हाइपोक्सिया. अगर उनका ऑक्सीजन सप्लाई 3 से 4 मिनट के लिए रोक दें, so they are dead. So that sort of thing. Okay, so I hope this is all very clear. Factors affecting infarct. Now I have to talk about the last topic of this chapter, and then the chapter is finished. And let's start our discussion about shock. Now, shock is a state in which diminished cardiac output or reduced effective circulating blood volume impairs the tissue perfusion and leads to cellular hypoxia. So shock की जो terminology है, it is kind of linked with the process of hypoxia. यानी there is oxygen depletion to the tissues, and that can be because of so many reasons. So for example, there is a type of shock which is known as cardiogenic shock, and that is the reduced oxygen supply for the causes which reside in the heart. तो for example अगर किसी भी वजह से मायोकार्डियल पंप फेलियर है, which can happen in myocardial infarction or any other thing, extrinsic compression such as cardiac tamponade, ventricular arrhythmias, outflow obstruction, pulmonary embolism उसकी example है. So for whatever reason, if there is problem within the heart, और उस हार्ट की प्रॉब्लम की वजह से पंपिंग ठीक नहीं हो रही और टिश्यूज को ऑक्सीजन नहीं मिल रहा, सो ऑल दोज कॉजेज आर अंडर द हेडिंग ऑफ कार्डियोजेनिक शॉक. देन देर इज अ कैटेगरी विच इज कॉल्ड हाइपोवॉल्यूमिक शॉक. यानी अब सिलसिला ये है कि हार्ट ठीक ठाक काम कर रहा है, हार्ट में कॉन्ट्रैक्शन का कोई मसला नहीं है, पंप बिल्कुल ठीक है, लेकिन ब्लड वॉल्यूम ही इनफ नहीं है. यानी इतना मतलब ये ऐसे समझेंगे घर में पानी की मोटर लगी हुई है और मोटर बिल्कुल ठीक काम कर रही है, लेकिन लाइन में पानी नहीं है, और अगर पानी नहीं है तो मोटर क्या खींचेगी, हवा ही खींचेगी ना. सो बिल्कुल ऐसे ही आपका हार्ट बिल्कुल ठीक है लेकिन सिस्टम में ब्लड ही नहीं है. अब ब्लड कहाँ गया भाई, यही तो हम बात कर रहे हैं, हाइपोवॉल्यूमिक शॉक. यानी यहाँ पे कोई ऐसा प्रॉब्लम हुआ है जिसकी वजह से there is severe fluid loss such as happens in vomiting, diarrhea, severe burns, या किसी का एक्सीडेंट हो गया, हेमरेज हो गया, ब्लीडिंग हो गई. इन तमाम कंडीशन में आपकी बॉडी का जो पाइपलाइन है, यानी कि जो वैस्कुलर बेड है, यानी कि जो आर्टरीज और वेन्स हैं, उसमें ब्लड इनफ नहीं होगा. ब्लड इनफ नहीं होगा तो इसे हम कहते हैं हाइपोवॉल्यूमिक शॉक, यानी वॉल्यूम कम है बंदे के पास. देन द थर्ड कैटेगरी विच इज अ वेरी कॉम्प्लिकेटेड टॉपिक, आई विल ट्राई टू कवर सम इंपॉर्टेंट एस्पेक्ट्स ऑफ दिस टॉपिक. दिस इज नोन एज सेप्टिक शॉक. Septic shock is triggered by microbial infections and is associated with severe systemic inflammatory response syndrome, which is also known as the SIRS, severe systemic inflammatory response syndrome. It may be triggered by a variety of insults including burns, trauma, pancreatitis. The common pathogenic mechanism is a massive outpouring of inflammatory mediators. Body actually बिल्कुल पागल हो जाती है और उसका जो inflammatory system है super duper excited हो जाता है, and the innate cells and the adaptive cells, they start producing so many mediators which lead to arterial vasodilation, vascular leakage, venous blood pooling. So the body feels like there is a state of hypovolemia basically. So tissues have hypoperfusion, उनको blood नहीं मिलता, therefore there is cellular hypoxia, therefore there are metabolic changes because as I told you, the body goes crazy about the immune system. A lot of cytokines, a lot of interleukins, and the body behaves bizarre. इनमें से कुछ steps अभी हम पढ़ेंगे भी, but that happens usually in state of sepsis, infection है या कोई पैंक्रेटाइटिस है. सो द इनिशियल इंसल्ट विल स्पीड अप, एक्सेलरेट, ऑगमेंट द बिहेवियर ऑफ योर इम्यून सिस्टम. द पैथोजेनेसिस ऑफ द शॉक, द सेप्टिक शॉक इज डिस्कस इन डिटेल बिलो, अभी हम डिस्कस करेंगे. सो दीज आर द थ्री मोस्ट कॉमन कॉजेज ऑफ शॉक. नंबर वन इज द कार्डियोजेनिक शॉक, हार्ट पंप फेल हो गया. नंबर टू इज द हाइपोवॉल्यूमिक शॉक, इसमें वॉल्यूम कम हो गया बिकॉज ऑफ हेमरेज, वॉमिटिंग, डायरिया, बर्न्स. एंड नंबर थ्री इज द सेप्टिक शॉक, इसमें कोई ना कोई सेप्सिस का इन्फ्लेमेशन का एंगल है जिसकी वजह से बहुत सारे साइटोकाइंस और बहुत सारे इंटरल्यूकिन्स रिलीज हो रहे हैं. सो दीज थ्री आर द मोस्ट कॉमन कॉजेज ऑफ शॉक. Less commonly, shock can also result from loss of vascular tone associated with anesthesia or secondary to spinal cord injury, but these are less common. अगर स्पाइनल कॉर्ड इंजरी की वजह से शॉक है, then this is called neurogenic shock. Anaphylactic shock is another example of shock, results from systemic vasodilation and increased vascular permeability, which is triggered by immunoglobulin E mediated hypersensitivity. So anaphylaxis is a hypersensitivity reaction. So these are less common causes. The more common causes are these ones. और फिर इन्होंने septic shock को थोड़ा डिटेल में explain किया है, just because of the fact कि septic shock is a little more complicated topic to understand. So they have spent some more time there. Septic shock is responsible for 2% of all the hospital admissions in the United States. That's a big number. It's a very big number. Of these, 50% require treatment in the intensive care units. यानी अगर 100 लोग admit हुए हैं, I'm just making up the number, so in 100 में से 50 लोगों को they will need ICU care, intensive care unit. The number of the cases in the United States exceeds 7.5 lakh per year, and the incidence is rising. You see why they have spent a completely different section, एक पूरा designated section है septic shock पे, because of the importance, the numbers are increasing, as well as growing in ranks, immunocompromised hosts. So the numbers are going up. These patients are serious. They require serious care. Now, despite improvements in the care, the mortality remains at a staggering 20 to 30%, which is a very high rate of mortality. हालांकि आप देखें आप कितनी advances हुई हैं ना medicine में treatment wise, but still you see the mortality rate 20 to 30. यानी 100 patient जो इस disease के साथ enter हो रहे हैं, उसमें से 20 से 30 patient they are dying. Septic shock is most frequently triggered by gram-positive bacterial infections, followed by gram-negative bacterial infection and fungi. Hence the older synonym endotoxic shock. So endotoxic shock is actually not appropriate, because most of the cases it is initiated by the gram-positive bacteria, then followed by gram-negative. So this term is now no more used, endotoxic shock. We rather use the word septic shock. The ability of diverse microorganisms to cause septic shock is consistent with the idea that a variety of microbial constituents can trigger the process. As mentioned in a separate chapter, macrophages, neutrophils, dendritic cells, endothelial cells, and soluble components of innate system, which is the complement system, recognize and are activated by several substances derived from microorganisms. So basically, there's a microorganism and it is driving a lot of immune system cells crazy. So neutrophil will be crazy, macrophages will be crazy, that sort of thing. After activation, these cells, immune cells की बात हो रही है, and factors initiate a number of inflammatory response that interact in a complex, incompletely understood fashion to produce the septic shock. You see, आज की भी डेट में कह रहे हैं कि it's a very complex and not clearly understood phenomena. Factors believed to play a major role in the pathophysiology of the septic shock are as follows. Number 1, inflammatory and counter-inflammatory responses. In sepsis, various microbial cell wall constituents engage receptors on the cells of the innate immune system, triggering the pro-inflammatory responses. Likely initiators of inflammation in sepsis are signaling pathways that lie downstream of TLRs, toll-like receptors, which recognize a host of microbe-derived substance containing so-called the pathogen-associated molecular patterns, which are called PAMs. ये PAMs microbial organism पे होगा. So, for example, this is a bacteria. It will contain some, structures which will be able to activate the toll-like receptors on the immune cells. So, ये जो चीजें activate कर रही हैं, इनको हम नाम देते हैं pathogen-associated molecular patterns, PAMs. तो ये PAMs का concept clear होना चाहिए. And then G protein coupled receptor detected in the bacterial peptides and C-type lectin. So there are bacterial stuff which can actually activate the immune cells. Upon activation, the innate immune cells produce a lot of different factors such as TNF, interleukin-1, interferon gamma, interleukin-12, interleukin-18, as well as other inflammatory mediators such as HMGB1, which is high mobility group box 1. So all these things are being produced by our immune cells because they identified the PAMs on the bacterial wall. Markers of acute inflammation such as C-reactive protein as well as procalcitonin are also elevated. In fact, we do check the levels of procalcitonin in many patients in whom we are actually suspecting septicemia. The later is a clinically useful indicator of septic shock, procalcitonin, septic shock. Clear indicator. Levels are high, it is a septic shock. Reactive oxygen species and lipid mediators such as prostaglandins, platelet activating factors are also elaborated. So these are also increased. These effector molecules include endothelial cells to upregulate the adhesion molecule. There is a complement activation. So you see what's actually happening. there is strong inflammatory response which is initiated in response to the PAMPs which is present on the bacterial structure. So बैक्टीरिया अंदर आया, उसमें PAMPs थे, बॉडी ने इसको आइडेंटिफाई किया, सारे इम्यून सेल्स स्टार्ट हो गए, साइटोकाइन वाइटोकाइन ये वो प्रोकॉल्सिटोनिन सब निकलना शुरू हो गया, कॉम्प्लीमेंट सिस्टम एक्टिवेट हो गया. सो दैट्स हाउ इट हैपेंस. ओके, सो इट contribute to the pro-inflammatory state. In addition, microbial components can activate coagulation directly through factor 12 and indirectly through altered endothelial function. ये भी हम थोड़ी देर में डिस्कस करते हैं. The accompanying widespread activation of thrombin may further augment the whole process. So all that they are explaining is basically to increase the inflammatory events in the body. And that is what we actually call the hyperinflammatory state. So आपकी body जो है, this is actually producing a lot of chemical mediators which is augmenting the inflammatory response. As a result, septic patients may oscillate between hyperinflammatory and sometimes immunosuppressed states. Now that's kind of very confusing for clinicians, but this is what actually is seen. Sometimes the immune system goes down, sometimes their immune system goes super active. Proposed mechanism for the immune suppression include a shift from the pro-inflammatory environment to the anti-inflammatory environment, which means from the helper T cell से वो helper type 2 response में convert हो जाता है. So anti-inflammatory. Production of anti-inflammatory mediators such as TNF, interleukin-1, lymphocyte apoptosis, so they are being dead, the immunosuppressive effects of the apoptotic cells and cellular energy. The point is, don't get confused, just remember this point, कि जब sepsis होता है, so sepsis का या septic shock का एक characteristic feature है super inflammation with the intervening environment of anti-inflammatory responses. So that's what happens in a patient with septic shock. The second characteristic feature is endothelial activation and injury. The pro-inflammatory state and endothelial cell activation associated with sepsis leads to widespread vascular leakage. Now that's an important phenomena, and that is one of the major causes of shock in these patients. कि जो vascular permeability है वो increase हो जाती है, and there is tissue edema which have deleterious effect on both nutrient delivery as well as waste removal. ज़ाहिर है अगर blood supply किसी भी area की disturb होगी और उससे पहले leakage start हो जाएगी तो all the nutritional supply will be disturbed. One effect of inflammatory cytokine is to loosen the endothelial cell tight junction. यानी cell to cell जो tight junction है ये lose हो जाता है, इसीलिए there is increased leakage and edema. The alteration impedes tissue perfusion and may be exacerbated by attempts to support the patient with intravenous fluids. Activated endothelium also upregulates the production of nitric oxide and other vasoactive mediators such as C3A, C5A, platelet aggregating factor, which may contribute to vascular smooth muscle relaxation. So all these effects combined together increase the vascular permeability. And then induction of a pro-coagulant state. Now this patient is more susceptible to coagulation. The derangement in the coagulation is sufficient to produce formidable complication which is called the DIC, disseminated intravascular coagulation. So platelets are consumed and there are microclot formation, and because of microclot formation, that's another problematic stuff. So imagine a patient with septic shock. This patient has a lot of problem, has a lot of inflammatory mediators in the body. This patient has edema because there is endothelial activation and vascular leakage. Now this patient has increased microthrombi formation throughout the body, and because of this all the platelets are consumed. अब देखें ये कॉमन सेंस की बात है कि अगर मैं कहता हूँ इस ब्लड वेसल के अंदर जगह जगह क्लॉट बन रहे हैं, तो इस क्लॉट बनने में कौन यूज हो रहा है? प्लेटलेट यूज हो रहे हैं, और जब प्लेटलेट्स यूज हो जाएंगे तो अल्टीमेटली प्लेटलेट का नंबर क्या हो जाएगा? कम. सो द नंबर ऑफ प्लेटलेट्स एक्चुअली इज रिड्यूस्ड एट द एंड ऑफ द डे, और नाउ दिस पेशेंट इज ससेप्टेबल टू ब्लीडिंग. अब ये पेशेंट ब्लीड करेगा. क्यों? क्योंकि इसके प्लेटलेट तो कम हो गए ना. प्लेटलेट कम क्यों हुए? प्लेटलेट कम इसलिए हुए बिकॉज इसके प्लेटलेट कंज्यूम हो गए. दिस इज कॉल्ड consumptive thrombocytopenia. यानी platelets are now consumed in making the thrombi because the patient is under the state of septic shock. So that's all very important. ठीक है, आगे पढ़ते हैं. The pro-inflammatory cytokines. Oh, I wanted to rub it and it made it more black. So the pro-inflammatory cytokines increase the tissue factor production by monocytes, possibly also from the endothelial cells, and decrease the production of, ये सुने, जो anticoagulant proteins हैं उनकी generation, उनकी production कम हो जाती है, and they include protein C, thrombomodulin. So अगर anticoagulant कम होंगे, so the person is in a pro anticoagulant form, yani the person will make more and more microthrombi. They also dampen fibrinolysis, increasing plasminogen activator. So overall effect is consumption of platelets, formation of microthrombi, and ultimately bleeding. Okay? So DIC is also a characteristic feature of patients with septic shock. Another characteristic feature is the metabolic abnormalities. Septic patients exhibit insulin resistance and hyperglycemia. Cytokines such as TNF, IL-1, stress-induced hormones such as glucocorticoid and glucagon and growth hormone and catecholamines all drive gluconeogenesis. So, chunki there is gluconeogenesis happening and there is insulin resistance, so overall effect is increased blood glucose level and hyperglycemia. At the same time, the pro-inflammatory cytokines suppress the insulin release. So इंसुलिन रिलीज नहीं है, इंसुलिन रेजिस्टेंस है, ग्लूकोनियोजेनेसिस है, देखें तमाम का इफेक्ट है इंक्रीज ग्लूकोज लेवल इन द बॉडी. ठीक है, right. What happens next? So promoting insulin resistance in the liver and other tissues, likely by impairing the function of GLUT4 receptor as well. Hyperglycemia decreases the neutrophil function, suniye, thereby suppressing the bactericidal activity. So the more bacteria are now there, दंदनाते फिर रहे हैं कि अब हमें क्या होना है, because इतना सारा hyperglycemia है तो हम पे तो वैसे ही neutrophil ने काम नहीं करना. So that's a problem and causes increased adhesion molecule expression on the इसकी वजह से there is more leakage through the vascular bed. Although sepsis is initially associated with an acute surge in glucocorticoid production, this phase may be followed by adrenal insufficiency and a functional deficit of glucocorticoid. Now, different organs actually fail in septic shock. One of them is then adrenal gland. Okay, after some time it will not be working as it used to work, and this is called adrenal insufficiency, and this is where there will be functional decrement in glucocorticoid production. This may stem from depression of the synthetic capacity of the intact adrenal gland or frank adrenal necrosis resulting from DIC. So adrenal gland microthrombi formation की वजह से वो blood supply जो adrenal gland तक जा रही थी उसको block करेगी, and there will be infarction and necrosis of the adrenal gland because of DIC. This is called Waterhouse-Friderichsen syndrome. Finally, cellular hypoxia and diminished oxidative phosphorylation lead to increased lactate production and lactic acidosis. So increased glucose, adrenal failure, lactic acidosis, these are all the metabolic effects of septic shock. And as a result of all these, multiple problems, what we see in the patients with septic shock is multi-organ failure, organ dysfunction. And this is actually multi-organ failure. Remember this, okay? Multi-organ failure. Systemic hypotension because of vasodilation, because of vascular leakage, interstitial edema, and small vessel thrombosis because of DIC, and decreased delivery of oxygen. Now, this is all enough to cause organ dysfunction. Mitochondrial damage leads to, impaired oxygen use. High levels of cytokines and secondary mediators. So everything bad is going on, and that ultimately, so different organs are failing, but if the respiratory system fails, this is what we call the acute respiratory distress syndrome. This is when we say the patient is perhaps moving towards fatality. So this is how the disease become fatal. Ultimately, these factors may conspire to cause the failure of multiple organs, particularly kidneys, liver, lungs, heart, and ultimately death. So guys, one thing, septic shock is a damn serious problem. Okay. Now, the severity and outcome of septic shock are likely dependent on the extent and virulence of infection, the immune status of the host, the presence of the other comorbid condition. So it's always, the same patient does not necessarily कि अगर एक patient में आपको एक outcome मिला है कि उसमें ये हुआ, death हो गई, ज़रूर नहीं दूसरा patient भी वैसे ही respond करे. हो सकता है उसमें जो initial infective dose है वो different है, हो सकता है कि patient का immune status different है. So there are different behaviors of different patients based on different factors के initiating level of infection कितना था, बंदे का immune system कैसा है. So the outcome of septic shock actually is variable. An additional group of secreted bacterial protein called the superantigens also cause a syndrome similar to the septic shock, and this is called toxic shock syndrome. Superantigens are polyclonal T lymphocyte activator that induce the release of high levels of cytokines that result in variety of clinical manifestations ranging from simple rash to vasodilation to shock and to death. So basically, if I have to deal with a patient of toxic shock syndrome, I will pay equal attention as if it was septic shock because the outcomes are almost similar. Okay. Now there are different stages of shock, so this is the next heading that we have to discuss. So basically जो shock के stages हैं, that actually कोई भी cause हो, cardiogenic shock हो या hypovolemic shock हो या septic shock हो, it usually goes through 3 different stages. पहला stage, and these are very logical and easily understandable. So the first phase is usually the initial phase where there is non-progression of the shock and the body is actually trying to do something जिससे वो जो भी initial cause of shock है उसको ख़त्म किया जा सके. So these are all the compensatory mechanisms of the body. So the body, if there is for example hypovolemia because of any cause, so the body will try to activate the renin, angiotensin, aldosterone system ताकि आपकी body में salt and water retention हो सके. So that is a compensatory phase. So body is still trying to make things normal. So this is the initial phase जिसमें shock actually progress नहीं कर रहा और body का compensation start हो गया है, body के efforts start हो गए हैं. अगर इस stage पर जो initiating insult है, जो भी cause है, so for example you have a patient with hemorrhage और ये patient road traffic accident के साथ आया है and there are bleeders, कोई ना कोई artery है जिसमें कोई damage हुआ है. So if in the initial phase you try to repair the damage and then you try to replace the liquids and everything is now under control, so basically the treatment is started, the cause is identified and the treatment is started first phase mein, then the patient will be fine. So that is the first phase. Nature tries to give you some time for management of these patients. So your body tries to nullify the initial insult, your body tries to make compensation for whatever happened, your body tries to bring things to the normal. So that's the initial phase. But if somebody is ignorant या patient delay के साथ hospital पहुंच रहा है या doctor उसको सही से treat नहीं कर रहा है या whatever reason, then the shock progresses to the next level, which is stage number 2. And in stage number 2 what happens is now the patient starts developing the problem और tissue hypoxia होगा, inflammation start, अभी जितनी हमने बातें करी थी, DIC start हो जाएगा, metabolic acidosis start हो जाएगी, oxygen consumption कम हो जाएगी. So basically the problems and the typical characteristic feature of shock will start happening in the second phase, which is known as the progressive stage. So the first stage was non-progressive, जिसमें compensation हो रहा था. The second phase is the progressive phase, and if the situation is not even handled at the second stage, then this progresses to the third stage, which is known as the irreversible stage, in which the cellular and tissue injury happen and system failure starts. So acute respiratory distress syndrome, for example, multi-organ failure, for example. So these things will happen in stage 3. So there are 3 stages of shock. The first one is non-progressive, then progressive, and then irreversible. Where do you see system organ failure? In the third phase. Where do you see characteristic features such as DIC, increased inflammation? You see these in stage number 2. Okay, so the first non-progressive phase जो है इसमें body compensate कर रही है. So the compensation includes, for example, renin, angiotensin, aldosterone system की activation, sympathetic system, catecholamine. So body is trying to make it up, and then if there is the second phase, then you start seeing problems in tissue hypoxia, glycolysis, anaerobic start हो जाएगी. So you have more lactic acid. So tissue pH जो है वो कम होना शुरू हो जाएगी because of addition of more and more acids. The patient will start having DIC, disseminated intravascular coagulation, जिसकी वजह से microthrombi बनेंगे. Further hypoxia होगा. So all the problems happen in the stage 2. Stage 1 is all good, compensatory. Stage 2 is serious. So try to control the disease here at stage 1. But if you are not able to control it at stage 1, stage number 2, then obviously stage 3 kicks in, and this is where irreversible damage happens and tissue death, and ultimately the person's death can also happen. Okay, so these are the 3 stages of shock. So that's all about this chapter. We completed this chapter. This is a good video, and basically not the video this is the good diagram to actually show what are the different steps and what are the different mediators involved in shock phenomena. अब बात सारी ये है कि ये सब हमने डिस्कस कर लिया. So spend some time here. The all story begins with the PAMPs. So this is a microbial organism, microbial product, pathogen associated molecular patterns. These, if enter in your body, they are identified by the system, by the immune system. And you see these are the neutrophils, and then there are monocytes. They are activated, neutrophil and monocyte activation. The complement system is activated, and the coagulation pathways are activated. तो ये तीन system जब activate हो जाएंगे ना, also the endothelial activation. Endothelial activation की वजह से there will be leakage, and vascular leakage is a key characteristic feature of shock. So you see the effects of these four activation. So first activation, for example, coagulation pathway activation. Second activation, complement activation. Third activation, endothelial activation. And fourth activation, immune system activation. अब हर activation के consequences हैं. अगर coagulation pathway activate हो गया तो procoagulant environment and microthrombi, microvascular thrombosis, और इस thrombosis की वजह से ischemia and organ failure such as adrenal insufficiency. अगर complement activate हो रहा है तो again it will lead to microvascular thrombosis. Endothelial activation, vasodilation, increased vascular permeability because of all these factors which are produced by the activated endothelium. Immune system activation, many factors, TNF, interleukin 1, HMGB1, a lot of other cytokines, and super inflammation as well as immunosuppression. So there is super inflammation with episodes of immunosuppression. All these effects ultimately will lead to multi-organ failure. So that's the concept that we discussed in this video. So I hope you liked the video. If you did, please share it with your colleagues and subscribe the channel. I will see you in another chapter of general pathology very soon. Take care of yourself.